Average wait time to see a doctor in 2022 was 26 days. That's the average. NBC7's Amber Frias dug into the issue and found out what is causing the delay and what it could take to solve it.
Trying to see a doctor, but you can't get an appointment anytime soon? Well, you're not alone. People across the state and the nation are having the same issue. They can't get in to see a doctor in an adequate time.
Can anybody see the light getting out?
Finding a doctor's appointment in San Diego has become anything but easy.
I started seeing blood in my urine. I tried to stay calm for a couple of days until I Googled it.
I had surgery July last year, and something went wrong. Went to the same doctor again, and he told me to have to go to another doctor, more experienced than he was.
I met Robert and Jesus at a shopping center in Oceanside after making a visit to a local medical center. They both expressed their frustration and confusion about this recent trend.
I couldn't get an appointment. I was told that it would be like a month and a half, sometimes 2 months out.
Now I gotta wait months and months and months before I can see this, before I can have the surgery with this other doctor. It's already been like 3 months and nothing. They haven't even called me yet.
And they're not the only ones. While researching, I posted to a few community pages on Facebook to get a sense of who's facing this problem. And the response was overwhelming. More than 200 people responded to my post. Others sent me direct messages expressing the same frustration.
I've been having some issues with my left ear. I feel like something is actually in it.
Hi, Julie. Hi. Julie Stavros is one of the respondents.
I waited a month and a half to see the audiologist, and finally I got to see them, and I found out that I have hearing loss, and I need to get hearing aids, and I cannot get in to be fitted or find out about the hearing aids until the end of June. I've never waited this long for a doctor's appointment before.
Long wait times are a relatively new trend. In fact, the California Care Foundation says 10 years ago, more than half of San Diegans could see a doctor within 2 days. Today, that number has fallen to just 20%, or 1 out of 5. And it's something doctors are well aware of.
We definitely see this on an everyday basis.
Hi.
Hi there, welcome.
Schalch Lepe is a doctor that specializes in conditions with the ear, nose, and throat.
And our group is big, and we're spread out throughout the county, and even with that in mind, oftentimes the wait times can be upwards of 4 to 6 weeks.
So why the long wait?
The short answer is we just simply do not have enough clinicians to provide the care that we need here in California.
Christoph Stremikis analyzes data about the state's care system. He says timely access to medical care is becoming a serious public health threat in San Diego and across California.
We don't have the right types of providers in the right places to meet the demand for medical care. Those were problems that predated the COVID pandemic. They certainly got worse because of COVID, but they're here and they need to be addressed.
And making matters worse, according to white paper by Definitive Healthcare, more than 330,000 healthcare providers left the workforce in 2021 alone, with physicians representing the majority. The biggest reason, according to those we spoke to, burnout.
Doctor burnout, of course, tends to occur when you're overworked, stressed out. You have to add many patients to your schedule, sometimes double book, triple book. This makes for long days, and patients, of course, are frustrated because they've already been waiting very long for their appointments, and then perhaps you're running late in the clinic, and it's this ripple effect.
According to a recent survey from InCrowd, a healthcare data provider, 30% of physicians said they felt burnt out, and about just as many said they would consider leaving the profession.
I have had the opportunity to mentor and talk down several of my friends from just flat out quitting medicine. They don't want to do it anymore.
Dr. Tina Edwards from World of Wellness in Oceanside is an emergency medicine doctor who decided to start a primary care practice that does not take insurance.
A lot of what drove us away from primary care in the first place was we didn't want to have to see 30 patients a day. We didn't want to have to try to cram a patient into 12 and a half minutes. And imagine trying to do that with a patient who's genuinely ill.
While Dr. Edwards was able to increase the time she spends with her patients, the problem for doctors doesn't stop at burnout. Many of them are having to spend more and more time dealing with insurance companies.
And now insurance companies, of course, have made the rules for approving procedures or diagnostic tests or any other kind of intervention more and more difficult and more stringent. So oftentimes you'll finally get your appointment, you formulate a plan, perhaps for surgery, perhaps for some advanced testing, and then the test or the procedure gets denied by the insurance for whatever reason. And that, of course, leads to an appeal or a peer-to-peer communication that is labor-intensive.
So there are fewer doctors who are largely burned out and an aging population that needs more care. In fact, according to the Association of American Medical Colleges, by 2034, the number of Americans over 65 will grow by more than 42%. So we need more doctors to help, right? Yes, but there is a problem there as well. Thousands of medical school graduates who are ready to provide care do not get the chance to.
And we have 8,000 medical school graduates every year who cannot become licensed physicians because they cannot get into a residency program because we don't have enough.
One of those upcoming graduates is Jason Gomez.
Unlike other professions like law school, where you take the bar and you're automatically a lawyer, or even in business where you can drop out of college or get an MBA to start a business or to change career paths, in medicine, you still have your licensing exams, step 1, 2, and 3, but you also have to do this residency program.
Gomez is a medical student at Stanford. He recently wrote about his experience applying for a residency program for a San Francisco newspaper. In his research, he found that last year, nearly 48,000 medical school graduates registered for the Match, an online system that pairs new doctors with hospital training systems. But there were just over 36,000 spots available. That means over 11,000 graduates cannot practice.
These people are ready to be a doctor. They're at their peak. They've finished their clinical rotations. They've done their first 2 board exams, but they're stuck in limbo in the sense that they can't actually practice or see patients. And so they have to wait a year. And some people end up deferring graduation, and others end up, reapplying after they graduate. And so it's a bottleneck, and it's keeping young doctors from being trained, and us as patients from having access to those doctors.
Stremikis acknowledges the problem, but says increasing residency spots requires policy changes.
We need to increase the overall number, and I'm talking about all types of clinical folks, these nurses, RNs, advanced practice nurses, MDs, community health workers, really up and down the line. We need more healthcare workers.
The solution won't come easy and will take time, but it's something Stremikis believes we can't ignore any longer.
This is a problem that impacts everyone, and I think it's important for all of us to care and be invested in the solution.
While the state is working on solutions to try and alleviate the problem, it may take some time for us to see any sort of result. In the meantime, though, there are some things you can do to try and speed up the process. You can call your doctor's office to see if they have any cancellations, or maybe they have a wait list. But ultimately, it's best that you equip yourself with a dose of patience. Amber Frias, NBC7.
And according to the Peterson Center on Healthcare, the U.S. spends more capital on healthcare than any other developed country in the world, but has subpar health outcomes. The average life expectancy in the U.S. is lower than in any other wealthy nation, and about 60% of U.S. adults have a chronic disease like cardiovascular disease, diabetes, and cancer.